hmm Just to dive a little deeper into this phrase that Dr. Christensen coined, that disruptive innovation, the book talks about it having three components: a simplifying technology, a business model innovation, and then a disruptive value network. Can you talk about those three things and how they fit, particularly in healthcare?
Yeah, and I alluded to this earlier when I described what a disruptive technology is and then how to properly deploy it. The problem when you introduce a simple disruptive technology is that it often doesn't fit within the existing system, right? It's a tool that often doesn't appeal to incumbent stakeholders. It doesn't work for the current system, and therefore it tends to get discarded rather quickly. On the other hand, if you could manage to find a what we would call a business model that is either a new set of users, a new set of customers, a new way of making money off of it, that is essential to making sure that disruptive technology actually gets implemented and deployed in a way that it was actually in a way that would actually benefit the system. So I'll give you an example. There was a case study that Clay taught at Harvard Business School that involved the first cart-based portable ultrasounds. So these were ultrasound machines that you could roll around from bedside to bedside, and they were meant as a disruption to the big floor standing models that sat in the basement of a lot of hospitals. And the existing users were radiologists because it was a piece of imaging equipment. It was next to all the other machines that radiologists use. So when these machines came about, that was naturally the market that these manufacturers would approach, right? They were the existing users. It was their patients that needed these tests. There was already a payment, process in place to reimburse for these tests. So of course, that's where you would go. But again, a disruptive technology like that really had little place in the existing market, because the radiologists would compare this new tool to the one that they already used, and it looked like a toy in comparison, because you had a big floor standing device that took much better quality images. And yes, it was more expensive, but that was of little concern because it was already paid for, or they had patients already scheduled to see it day in and day out. Why change? And it wasn't until there were new delivery models that came into play that could use this tool. Suddenly we realized, well, it's not just radiologists. There were lots of clinical areas and practitioners that could use this tool. And so you started to see it show up in OBGYN offices, in the emergency room and urgent care, in the cardiologist's office, in the ICU. There were lots of areas that could use a tool like this, so that you didn't have to send every patient to the basement to get an ultrasound anymore. And so that's part of that. That's an illustration of what we mean when a disruptive technology still needs a disruptive business model.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.